Welcome to the podcast. I'm Jess, a family nurse practitioner and legal nurse consultant, and this is the space where healthcare, law, and real-life situations intersect. Each episode is designed to break down complex medical and legal topics in a way that's clear, accurate, and grounded in evidence, without fear, misinformation, or sensationalism. Whether you're a healthcare professional, attorney, gig worker, parent, or simply someone who wants better understanding of how medical events and legal responsibility overlap, you're in the right place. Let's get started. Quick story to start. A patient I once cared for was listed as allergic to a commonly used antibiotic. That allergy noted in the chart led 3 clinicians to avoid that medication, including a drug that would have treated their infection fastest. The team reached for weaker alternatives. The infection lingered, and the patient spent days longer in the hospital. Later, when we dug into the record, the allergy had been entered after a mild rash years earlier and never clarified. One small entry changed the course of care. Today, I'll show you how to avoid that kind of problem, how to get your records, read them without getting lost in jargon, spot trouble, and use your chart to get safer care. Section 1. What is your medical record and why it matters? Your medical record is the living story clinicians use to treat you. Notes from visits, medication lists, allergy entries, lab and imaging results, operative reports, and discharge summaries. Records live in different places: hospital electronic health records, primary care clinics, specialty offices, urgent care centers, and increasingly patient portals like MyChart or the patient-facing sections of vendor systems. Under federal law and HIPAA, you have the right to access your records, request copies, and control many forms of sharing. That doesn't mean every system works the same way, but the right to see your information is real, and it is powerful. How to request records, practical steps, and exact scripts you can use. First, check the patient portal. Many labs, imaging reports, and clinic notes appear there automatically. If your portal doesn't have what you need, submit a written request to the medical records department. Include your full name, date of birth, a clear description of the records you want and the date range, and whether you want electronic or paper copies. Here's a short, practical script you can copy. I am requesting a copy of my medical record for care coordination. Please send all clinic notes, medication lists, allergy information, and imaging and lab results from start date to end date to my email at your email or mail to your address. If you prefer phone, call the records office and say, "Hi, I need a copy of my records. Who handles patient record requests and what do you need from me?" Know the timelines and possible fees. Many providers must respond within 30 days and may charge reasonable copying fees, though electronic access is often free. If a request is complex, they can ask for a 30-day extension, but they must tell you. If you hit a roadblock, ask for the facility's privacy or release of information officer and keep a dated copy of your request. Small tip: use email or certified mail when possible, so you have proof of delivery. Section 2. Reading the chart, the pieces that matter, and plain language definitions. Start with the problem list. It's the clinician's quick roadmap of active concerns. Then check medication lists and allergy entries. These are immediate safety items. Progress notes tell the narrative of clinical encounters. Admission notes and discharge summaries give the big picture decisions. Labs and imaging reports provide objective data. Labs often have normal ranges listed, and imaging reports contain the radiologist's interpretation. If something is dense or technical, focus on the interpretation or impression section. That's the bottom line clinicians use. How to read specific entries without getting lost. For a medication list, confirm the drug name, dose, frequency, and listed start date. For allergies, look for the reaction. Rash or anaphylaxis matters a lot. For lab results, notice the value, the normal range, and whether the clinician added follow-up instructions. For imaging, read the impression first. If a term is unfamiliar, note it down and ask your clinician to explain in plain language. I encourage you to bring a printed or screenshot copy of concerning entries to your appointment. It makes conversations concrete. Spotting errors and red flags, this is where your attention can prevent harm. Common mistakes include incorrect allergies, outdated medication lists that still show drugs you stopped, mismatched demographics like wrong birth date, and transcribed errors in doses. Discrepancies between notes, for example, one note says no shortness of breath and another documents severe shortness of breath, should catch your eye. Also watch for missing results. If a test was done but never interpreted in a clinician note, that's worth asking about. Small errors create big risks during handoffs, prescriptions, or in an emergency.
Curious. Quick checks you can run in minutes. 1. Does the medication list match what you're actually taking? 2. Are your current providers listed correctly? 3. Are allergies and reactions described? If you find an error, document it with a screenshot and date. Then contact the medical records or your clinician directly. That documentation will be useful if you need to request a formal amendment.
Section 3. Using records to advocate, plus correcting errors and legal basics. Bring your records to visits. A printed list or a phone screenshot of key entries makes discussions faster and clearer. When referring to another clinician, send a concise summary with the most relevant notes, labs, and imaging. Don't assume the other team will read every note. Use template language like, per my medical record dated date, I was prescribed drug and had imaging showing finding. Please consider this history when planning care. That explicit guidance reduces missed context. If you need to correct the record, you can request an amendment. Submit a brief written statement that identifies the specific entry, explains the error, and states the correction you want. Example wording. On date, the note by Dr. X lists an allergy to drug. I do not have a history of severe allergic reaction. My reaction was a mild rash in year. Please correct the record to reflect allergy, mild rash, not anaphylaxis. The facility must respond. They can accept the amendment, deny it, or add your statement of disagreement. If the facility denies your request and you believe patient safety is at risk, escalate to the privacy officer or consult an attorney experienced in health privacy or medical records.
A few safety and privacy notes before we wrap. Share records only with trusted providers and use secure channels. If you must share sensitive documents, ask the releasing facility to redact irrelevant sensitive information. And if you're working with an attorney or advocate, provide only the pages needed for that matter. You don't have to broadcast your entire medical history.
3 clear takeaways you can use today. 1. Get your records. Check the portal first, then submit a written request if needed. Use the short script I mentioned to make it simple. 2. Focus on safety items when you read the chart, medications, allergies, and the most recent problem list. If something doesn't match what you know, document it and bring it up. 3. Use your records to make care safer. Bring them to visits, send concise summaries to new providers, and request amendments when entries are incorrect. Those 3 moves prevent mistakes and make clinicians' jobs easier. If you want a printable checklist and the exact scripts for requesting records and amendments, visit the episode page linked in the show notes. And if you found this episode helpful, please subscribe. It helps this education reach the people who need it most. Let's separate medical fact from fiction and make sure your record works for you, not against you. Thank you for listening. If today's episode helped clarify a medical or legal issue, or made you think differently about how emergencies and accountability intersect, that's exactly why this podcast exists. I'm Jess, a family nurse practitioner and legal nurse consultant, and I work with attorneys, organizations, and professionals who need clear medical insight in complex cases. You can learn more or schedule a consultation at faqbynursejessconsulting.com. If you found this episode valuable, please share it, subscribe, and leave a review. It helps this education reach the people who need it most. Until next time, stay informed, stay compassionate, and always put safety first.